Okay, on that note, of course, we come to our closing. Remember, we will ask you questions again. Before we start with that, of course, I'd like to thank our faculty. I've seen Doris Hansen on the screen. Thanks to her. Thanks for participating. Worked perfectly, and thanks for your contribution. And of
Thank
course,
you.
yes, and thanks, of course, to our faculty who took the task to tell you everything about their field in 10 minutes, which is fantastic. Thank you very much. And yeah, we come to the final questions. Please don't forget that we would like to have your feedback. This is important for us to again get the credits for the CME. And now we come back to our first question. The following characteristics is associated with an increased efficacy of CARs. You've answered this question before. Is it low metabolic volume, downregulation of interferon gamma, p53-mediated tumor-induced immune privilege, p53-mediated inhibition of extrinsic apoptosis? Yeah, I think we've had that before, and there's not more to say. Thank you very much for answering this question this way. Second question was the false statement regarding the use of commercially available CAR T-cell therapies. Patients with relapsed refractory myeloma who have received prior BCMA-directed therapy show a reduced overall response rate to ide-cel. A significant proportion of patients who would be ineligible to participate in the pivotal CAR-T clinical trials can benefit. Patients with DLBCL and secondary CNS relapse do not respond to CAR T-cell therapy, and due to access production challenges, only 30 to 40% of patients receive treatment. That's an easy one because we've presented cases for it. I mean, the problem is that you already knew everything beforehand, so I don't think we've made a huge impact. But nevertheless, thank you very much for staying around for such a long time in the afternoon in such a wonderful day in Frankfurt. Last question, the 75-year-old woman with the fourth-line treatment who has some comorbidities but is still able for treatment. Selinexor, belantamab, ide-cel, or cilta-cel, or teclistamab? That's the question. Fourth line.
Uli, maybe while we wait,
yeah.
Do you know what extrinsic apoptosis is?
Extrinsic apoptosis? You tell me.
First question. I thought apoptosis was something in the cell happening. How can it be extrinsic? That's a clue. I remember from multiple choice testing in medical school.
Yes.
If it's too complicated, it's probably not the one.
Right. Okay. Yes?
It's triggering it. But.
3. Okay, so thanks very much for putting me on the spot. Before you leave the meeting, I'll leave the meeting immediately. Please complete the evaluation form for the EBA accreditation, and you can scan the QR code and then claim your EBA points. And thanks very much for being such an interactive audience. Thanks for the questions. We've received many more questions than we could answer. And thanks to the faculty and, of course, to the team from the Lymphoma and Myeloma Hubs for preparing and helping us with the preparations. Thank you very much. Thank you.